Welcome to the COOP for Rural Hospitals webinar series. This is webinar 6, COOP 201. In this final webinar, we will review strategies and tactics related to training and exercising the COOP plan.
Before we begin our webinar, let's review the components of the Rural Hospital COOP Toolkit. While this toolkit was designed specifically for rural hospitals, other hospitals or other healthcare organizations may find benefit from the elements in the toolkit. This toolkit has been specifically designed for rural hospitals and includes 6 components which you see listed on the graphic on the screen. The first component is a COOP Plan completion guide, and the second component is a COOP Plan template. These are designed to work together to help hospitals customize their COOP plan. The third component is a COOP tabletop exercise in a box that includes all the materials you would need to design and conduct a tabletop exercise at your hospital. The fourth component is a collection of resources related to COOP planning, specifically COOP planning industry standards and best practices. This curated list of resources may be helpful as you write or update your hospital's COOP plan. The fifth component is a frequently asked questions document to help you explain COOP planning to your peers and executive leaders. The sixth and final component of this toolkit is this series of webinars to help continuity planners complete or update their hospital's COOP plan. The webinars are focused on the first 2 components of the toolkit, the COOP completion guide and the COOP plan template. The completion guide has been designed with activities and explanations of how to write a COOP plan for your organization. As you complete the activities, you can move answers into the COOP template. The template can be edited or adjusted however you see fit to meet the needs of your organization. If you already have a COOP plan, you can use the completion guide to help augment or revise your current COOP plan.
And now for webinar 6, COOP 201. In this webinar, we will focus on strategies and tactics related to training and exercising the COOP plan.
This is a roadmap graphic that describes the 4 phases of COOP planning, and each phase corresponds to a bend in the road. There is a red chess piece that will move with us as we progress through this roadmap and progress through the webinars. Step 1 in the COOP planning process is to prepare. Preparing includes building your COOP planning team and setting up your project management plan, as well as understanding the COOP planning elements and the regulatory environment. Webinars 1 and 2 focus on step 1. Step 2 in the COOP planning process is to write your COOP plan. Webinars 3, 4, and 5 guide you through writing your COOP plan and using the COOP completion guide and the COOP planning template provided in the toolkit. Step 3 is to train and exercise so your staff know how to activate the COOP when needed. This will be covered in webinar 6. And finally, step number 4 is to evaluate and improve your COOP plan. This will also be covered in webinar 6. We will refer to this roadmap graphic and the 4 steps of COOP throughout this webinar series.
Here we see 2 roadmaps. On the left roadmap, our red chess piece has moved to step 3, train and exercise. On the right roadmap, our red chess piece has moved to step 4, evaluate and improve. In this webinar, we will focus on identifying how an organization may implement some strategies and tactics related to training and exercising the COOP plan. We will build on what we discussed in webinars 1 through 5. Again, please have the COOP completion guide, COOP plan template, and your current COOP plan, if you have one, available. If you want to follow along in real time, you can pause this webinar at any time. Once an organization has committed time and effort to developing a COOP plan, the critical next step is to train employees on the newly developed plan and then to exercise the plan to see what components need to be adjusted or changed. Training should ensure all levels and types of employees know there is a COOP plan and understand their role during a COOP activation. Some may have big roles, some may have smaller roles, but it is important everyone understands what the COOP plan is and what their actions or inactions are during a COOP activation. Examples of training may be reviewing smaller sections of the plan during safety huddles or all staff meetings for everyone to become familiarized with the document and to have an opportunity to ask questions. Another example of training the COOP plan could be the review and explanation of the organization or facility's individual essential functions and talking through who or what it takes to support the essential function. Testing or exercising serves as a knowledge check for both the trainer and trainees to ensure what has been trained is understood. Testing might look like a test at the end of a session related to the organization's or facility's COOP plan. Exercising the COOP plan can be anything from a safety huddle and leading a small discussion-based exercise regarding a component or a section of the plan to a full-scale exercise. However, it is encouraged to start small and be consistent. Exercising the COOP plan does not have to be a huge task and can even be incorporated into an existing exercise. Consider developing a continuity objective for an upcoming exercise, maybe focusing on maintaining one of the identified essential functions and see how that goes. Ultimately, training, testing, and exercising gives an organization or facility the opportunity to identify gaps ahead of a true emergency and ensures a more effective and comprehensive response effort. Once training has occurred and exercises have been completed, the next step is to take what has been learned and do something with it. The way an organization or facility will collect this information is through evaluation. During an exercise, this may be completed with an exercise evaluation guide, EEG, or recording the exercise to be able to review as a group. What do we do once we have all of this data and feedback? The hope is that an organization would learn from the gaps and challenges experienced during the testing and training exercise phase and implement mitigation strategies to lessen the impact of a COOP incident. For example, if during an exercise, food services noted their essential function to prepare food was not possible because they weren't able to access patient diet cards during the exercise, a mitigation strategy would be to identify the process for ensuring patient diet cards are available and accurate within an hour of a COOP plan activation. The ultimate goals of Step 3, train and exercise, and Step 4, evaluate and improve, is to ensure that knowledge is shared and gaps are addressed. So when the bad day happens and the COOP plan must be activated, the organization or facility is confident and prepared with their COOP response. That brings us to the end of Webinar 6, COOP 201, which is the final webinar in this COOP for Rural Hospitals webinar series.
This webinar was prepared and recorded by All Clear Emergency Management Group under contract with the Minnesota Department of Health Emergency Preparedness and Response Division. If you have any questions, please see their website at www.health.state.mn.us/about/org/EPR.